Today we shall be diving into a very important topic that affects the health of so many children. So if you are a parent or a caregiver, a nanny, a teacher, or you are just curious to learn more about children's health, stick around. Let's get into it. Some time ago, I made a video on snoring, and one of the comments from that video was whether there's a relationship between snoring and speech. Before we progress, snoring generally has several causes, but the commonest cause of snoring in children is enlarged adenoid and tonsils. So do well to watch that video on snoring. I'll be putting the link in the comment and also in the description below. So do well to watch it at the end of this video so that you can understand where we are coming from. Basically, adenoid are normal tissue in our body that is located just behind the nose. So there is a space there called the postnasal space, and that is where the adenoid tissue is located. There is also the tonsil, which is just behind the mouth, and so they can get enlarged if there is an infection, allergy, or any inflammatory issue within that area. A child that has enlarged adenoid usually have problem breathing. Often they are found to be opening their mouths to breathe, having noisy breathing, even when they are awake and when they are asleep, which is the snoring we talked about them. The child can also have sinusitis, problem of the nose and the paranasal sinuses. The child can also have ear problem, sleep apnea, sleep disturbance, and the rest. Now, having understood the basis of snoring and what could lead to snoring in children, let's go into finding out if there's a relationship between speech and snoring. Yes, there can be a relationship between snoring and speech, whether in articulation or speech delay. Now, to start with the articulation problem, a child who has enlarged adenoid and enlarged tonsil may have problems articulating certain letters, and so this will not affect how the child pronounces certain words. For a child with enlarged adenoid, there will be problem in pronouncing words that has M, N, and NG. For a child who has enlarged tonsil, the child may equally have problems pronouncing certain words containing letters containing K, G, and MG. So you find that this child has problem in pronouncing words containing these letters. And if there is a problem in pronouncing all these words, yes, this child may have problem in speech. You may find out that that child may have issues talking. What he's saying is not clear. Instead of saying girl, he's saying del. Instead of child saying mango, he's saying ango. So you find out that that child may have problems making certain words, pronouncing certain words effectively. In addition, an enlarged adenoid can cause hearing loss, which will now lead to problem of speech and language delay. So how does this come about? The ear and the nose are connected with a tube, just same area where the adenoid is located. So when the adenoid tissue grows so big, it may compress on that opening. It may even totally block it. This blockade may cause fluid accumulating in the middle ear infection, and even hearing loss. The problem is that a child who does not hear cannot speak. So if a child has developed hearing loss due to the enlarged adenoid, this may equally affect the language and speech. Imagine if I have not heard Spanish before. Do you expect me to know how to speak Spanish? Of course, I won't. So, for one to speak, hearing is very, very important. So, the answer to your question is that a child who snores has the possibility of having problem articulating words and speech delay because of those explanations I have given. So if your child is experiencing any of this, I will advise you take the child to a children doctor and equally see a doctor of ear, nose and throat so that that child can be properly evaluated. So do well to share this video to other parents, caregivers and teachers so they can benefit from this discussion. Subscribe, follow my page if you are yet to. Of course, there are other causes of speech delay, so check them out here.